Hello, I'm Dr. Dawn Buse, and I'm here with the American Headache Society Facebook Live series, a special edition for healthcare professional wellness during the time of COVID-19. To introduce myself, I'm a psychologist. I'm a member of the American Headache Society Board of Directors, and I'm a clinical professor of neurology at Albert Einstein College of Medicine, which is in the Bronx. And if you're watching this sometime in the future, today is May 1st. So we are 2 to 3 months into the pandemic in the US and around the world, a few more months beyond that. So if this is, 5 to 6 months for China and maybe 4 to 5 months in Europe. And that matters so much because certainly this has been an evolving situation with changes in knowledge, policies, and procedures on a daily basis. And this pandemic has put such demands and brought major stressors and worries to healthcare physicians and healthcare providers and first responders around the world, really like nothing else in many of our lifetimes. This has been a major, major event that has affected so many people in so many different ways. So talking to friends and colleagues in China, in Italy, in US, many friends and colleagues in New York City, thinking about what are some of the stressors. Here's some of the things that I hear the most often. And since this is a Facebook Live, I invite you, please, to type in other stressors and issues that I may have not thought about or I may not remember to mention, but certainly lack of PPE has been a major stressor from the beginning, as well as personal fear of becoming sick or bringing home the virus to family members, children, senior parents, others. And this is something that is not typical for a lot of healthcare professionals in a lot of disciplines. We don't tend to have to worry about catching the disease or condition that patients have, unless we're in perhaps infectious diseases or maybe work in the emergency department. But for many people, this amount of fear of exposure combined with the lack of PPE is creating huge emotional and physical stressors. Understandably, this is hitting us at the core of our human basic instincts for survival. We are coded to survive, and this is very, very scary. Um, there's been certainly a lack of information, lack of coordinated information, and evolving information, changing policies on a daily and sometimes people joke even hourly or minute by minute basis because we're facing something we don't know the answers for and haven't faced before. This lack of information creates a lot of stress. Lack of knowledge and lack of knowing what's coming is a very stressful and uncomfortable place to be for healthcare professionals or for anyone. So that's a major stressor. Many healthcare professionals pivoted very quickly to telehealth and had to think about, were there things that we couldn't do for patients? For example, in headache care, was there physical interventions that we couldn't do? And so did we need to think about how to care for patients um, with now a different set of resources? Also, telehealth is a technology that may have been unfamiliar to most people and also is a different skill set to connect with people um, in a more distanced way than we're used to. And healthcare professionals at heart are people who care. It's in the name. There's a lot of the personal interaction that's rewarding and valuable in the patient professional relationship. Um, at the same time, people have maybe been asked to work longer hours. Healthcare professionals have been deployed to different settings, different places, maybe doing things and skills that they hadn't done for many, many years, if at all ever, as well as their staff that they care about and depend on being deployed elsewhere. Some places have longer hours. The financial strain is certainly hitting everyone, including institutions and medical systems, which now may be advising pay cuts or cuts to benefits, which is a stressor, of course. Um, and there's personal stress, there's lack of sleep, there's anxiety, there's insomnia. A lot of the outlets that we all enjoy um, including hobbies, including social interactions, including exercise, including being out in nature, travel. All of those things have been temporarily limited or cut off. And if you're like me, I'm working from home with a 1-year-old and a 4-year-old, and don't be surprised if someone knocks on the door crying during this very podcast, because that's become my life. And so people are working from home, maybe without childcare. Most of us don't have childcare help right now, and that's a struggle too. Um, and the list could go on and on. There's as many ideas and issues, challenges, and stressors as there are individual people out there. But those are some that I am hearing frequently from colleagues. I have been amazed and impressed by how quickly our research colleagues, including scientific writers, whether they be physicians or other types of researchers, as well as editors, have gotten out information to us. I think that's been impressive and wonderful and really quick and something we need. So in doing a quick search of the literature for this presentation, I already found several publications looking at primarily how healthcare professionals from China are doing, because being a couple months ahead of the US, they're a couple months ahead of us in publishing as well. So a study that was just published in JAMA quite recently of healthcare workers in China used validated instruments and found that 50% met criteria for depression, 45% for anxiety, 34% report insomnia, and 73% report distress. Not surprising at all. And when they looked at risk factors for who was more likely to experience these conditions, frontline healthcare workers, those working in Wuhan versus further out in the country or in more rural areas were more likely to experience this distress, as well as women, as well as nurses. And thinking about that finding that people in Wuhan are having higher levels of psychological and emotional distress is important, because I think that relates to also our colleagues in some of the hardest hit areas like New York City, our colleagues in northern Italy, and other places around the world who are especially hard hit. And we really need to think about how this is impacting them, especially with more and more demands and fewer resources. And we all know that that combination of higher demands and lower resources is the scientific equation for learned helplessness, which is a precursor to depression. So we really want to watch out for that disparity between demands and resources and abilities. Another manuscript published in also in April did several measures of instruments of Hamilton Anxiety Scale, Hamilton Depression Scale, and interestingly, the more than 2,000 respondents, they surveyed both healthcare professionals and administrative staff, and found that across all conditions that healthcare professionals were about twice as likely as administrative staff to be experiencing any of the conditions, including they looked at obsessive compulsive traits and rumination and insomnia and some other traits. And there are a couple other very nicely done and quickly published articles on PubMed right now, which I found really helpful, and we're posting links right on this Facebook Live, so you should see them coming up as I speak. And there are more things coming out every day, including a nice article by Dennis Charney and his colleagues in New York City about coping with life during this major pandemic for healthcare professionals. So a lot out there about how this is affecting people. You know, why are those important studies? I think that those studies are important because it is reassuring and validating to know that on a global scale and on that in works that pass scientific review, that this is how humans respond to major prolonged stressors. It's important because just like we always advise our patients, know that coping with a chronic illness is associated with high rates in depression and anxiety, it's comforting to remember other people are in the same boat, and this is a normal human reaction to coping with prolonged serious stressors. Other consequences certainly are currently acute stress disorder and longer term post-traumatic stress disorder, which it's estimated that people especially in the hardest hit areas globally, will experience at pretty high rates, and something I want us to keep talking about as we go forward in the months and years ahead about how to treat and care for healthcare professionals who are experiencing post-traumatic stress disorder, thinking about the signs and symptoms and what treatments are available. On the good side, I've also been amazed and impressed with how rapidly scientific organizations, individuals, healthcare settings, hospitals, universities, medical centers have put together resources. And this reminds me of that lovely quote by the late, great Mr. Rogers, who said, "When I was a little boy and I was scared, my mother would say, 'Look for the helpers. There's always helpers.'" There are some wonderful resources, both educational, interviews, as well as support and advocacy on the American Academy of Neurology website. Very quickly, they put together resources that are under their Live Well section, which is a section which is always there, but they enhanced it, related specifically to the pandemic, as well as they have a whole section of COVID-19 related resources for professionals about neurologic consequences, about caring for neurologic patients with COVID-19, etc. So they have the professional scientific side, and then they have the Live Well section, including interviews and wonderful links. The American Medical Association has wonderful links and advice, as well as other organizations that I've really enjoyed reading what they've posted. American Psychiatric Association, American Psychological Association, the Center for the Study of Traumatic Stress, um, other links that we're posting right now, right here. You should see down the chat boxes on the side of this talk right now. Um, Other individuals have done things, cities have done things. I think that some of our governors and mayors in the US have stepped up to this challenge in amazing ways, and I want to commend and thank them for being such good local leaders. There is a physician support line, a free and confidential hotline, staffed by volunteer psychiatrists. We're putting the 888 number up right now. Headspace, an app which offers mindfulness meditations, is offering free Headspace Plus to all healthcare professionals for the rest of the year. And we do know that relaxation and mindfulness interventions are really important right now. Now, I'm speaking to probably a lot of neurologists and other healthcare professionals. You are the experts on the nervous system. You all know that we cannot go on with this type of activation of our nervous system for such a prolonged time without consequences. We need to calm, we need to deactivate, we need to disengage our typical cognitive loop of all of our worries for at least some time every day. And let's consider it beneficial exercise of our nervous system, whether it is a guided visual imagery or relaxation or meditation, whether it's prayer, whether it's a favorite funny video or your favorite song, whether it's petting your dog or taking a walk somewhere safely that you can, whatever it is, please remember the importance right now of disconnecting for some time every day, ideally twice a day, and doing something that calms the nervous system and brings some relaxation and distraction. There's yoga apps, there's Peer RxMD, a free peer-to-peer program for physicians and other healthcare professionals for support, connection, encouragement. There's a Slack channel for medical students to talk to each other, medical students versus COVID-19, putting all these resources on the side. Psychologists and psychiatrists in Canada got together to offer free therapy to healthcare professionals. It started out being called Ontario COVID-19 Therapists, as well as in the US. New York State has a hotline that Governor Andrew Cuomo announced last month. And then I've been really impressed at the institutional level how many resources there are. My home institution, my previous institution in Montefiore Medical Center, has pivoted all of the mental health workers to provide free, on the spot or more formal individual group therapy, other support, other relaxation experiences, as well as I was talking to colleagues at UCSF who have put together a great program of constantly expanding wellness initiatives. So I encourage you to check with your institution, maybe your current institution, maybe you'd even reach out to your medical school institution, your residency institution, look at the EAP programs and check with HR. I've been amazed and impressed by how those folks across the country, around the world, are really, really mobilizing quickly to provide as much support as they can. So there's a lot of support out there. Um, when it comes down to it, the basics that we need to remember are pretty much the same basics that come from our seeds for migraine success, which of course is stress management, sleep, eating healthy, staying hydrated, exercise. Those basics, as we all know, keep us all well and functioning and running. And during now more than ever, do we really need to attend to our basic needs in whatever way possible. And it might be a reminder that you set on your smartphone. It might be checking in with colleagues or family or people you're sheltering in place with if you're at home and reminding them that that's important. So that's number one, take care of your basics. Two, take breaks. You really need to take a break where you get away from patient care and you get away from media, whether it's traditional media or social media. There's too much bombarding our systems right now. Please take that break, 10 minutes of something funny, distracting, enjoyable, pleasant, calming, any of the above. That's really important to get your nervous system to relax a bit, calm down, reset. And I don't need to explain to you how the nervous system works. You know that that's important right now. Staying connected is important. This virus and this pandemic actually has hit us right where a lot of our basic needs are. And humans are quite social in our connections and our well-being. So the fact that we are so limited and distanced from each other, whether it is physically, whether it is wearing PPE, where we can't actually watch each other's lips move, where we can't see much of the face, um, limiting hugs and handshakes and touches on the shoulder. It may all seem very trivial, and yet when we think about the benefits all of those actions have on our nervous system, when we think about the neurotransmitters and hormones that they release, those are pretty essential to our well-being, and we're missing that right now. So think about, can you stay connected with colleagues and friends via technology, via online chats, via online support groups, via social media support groups that you find uplifting and helpful and supportive, not those that are too draining. Please turn down your attention to those for now. And with anyone that you are physically sheltering in place with or was in your social space, remember about hugs and eye contact and smiles and handshakes. Those are all really restorative and healthy for us as humans. It doesn't have to be humans either. Pet your dog, pet your cat, spend time with animals in nature. They are very restorative for us. Um, Also, I want to recommend, think about respecting differences. One person's comfort level and need for physical and emotional connection can be very different from another. Certainly, I feel like I'm someone who is more comfortable with a lot of physical touch, a lot of sharing of personal information, both sharing and receiving. Someone else may be more reserved, and everyone copes with stress in a different way. So please keep that in mind and don't take offense to someone who doesn't open up as much. Or if you are more introverted, perhaps just let people know in some way that you appreciate their attention, or they're checking in on you, or they're caring. Um, but keep to a level that you're comfortable with, because we don't want to create stress that way. Um, Think about performing self check-ins. So as healthcare professionals, as caregivers, we are very much other oriented. We are always thinking about everyone else. And to the extent that we don't often think about ourselves, and we often let go of our own self-care. So I welcome you, I invite you, I implore you to do regular self-care checks, regular wellness checks. Check on your mood, your anxiety, your sleep, your nutrition. It's really important. And this is not selfish. Self-care is not selfish. You must be able to be well enough yourself to care for others. So if you think about when you're on a flight and the flight attendant's giving you the safety information, she or he holds up the air mask and says, what does she say? Anyone wants to type it in here? We'll see if anyone gets it. We know what they say. They say, put on your mask before helping others around you. Of course, the reason being if you're passed out on the floor, you can't help anyone around you. Well, that really applies right here, right now. Please put on your mask before helping others around you, or immediately before or while you're helping others around you. You really need to take care of yourself during this time as much as possible. And please be willing to accept help. That's the other thing about us as caregivers. Not only do we think about others all the time, is we're not always comfortable about being cared for or accepting help ourselves. If someone else is saying, hey doc, what can I do for you right now? Don't say nothing. Come up with a list. That would be great if you picked up X for me at the grocery store. Absolutely, yes, I would love some oranges off your tree. Whatever it is, accept help. Again, I'm going to say this is not selfish. You know why it's not selfish? Because it makes them feel good to help you. So many people right now in the world want to express gratitude, support, and appreciation for healthcare professionals and other first responders, and they don't know how. So if someone says, can I do X? Say yes. Let them help you, whatever way that is. And there are more generous offers right now out there than I think I've ever seen, coming from food chains, coming from service organizations, coming from local governments, coming from more grand scales. See what's out there and treat yourself to some of those offers for food, for services. People want to help. And finally, please acknowledge that together we are living through one of the most difficult times we've ever experienced as humanity. This is hard, and this is really hard for healthcare professionals. We have rarely, if ever, had this amount of physical danger coupled with this amount of emotional and psychological stress for this duration of time. Be gentle on yourself. Please don't be judgmental of yourself and your own emotional and physical reactions. Know that they're real. Know that they are valid. Know that they are our elegant survival mechanism that our beautiful brain has put together, and that our brain is doing and our nervous system is doing exactly what it should. And think about ways that you can support yourself and support your colleagues during this really difficult time, because you deserve that.